Welcome to All Theory, No Conspiracy. Don't forget to like, subscribe, click to receive notifications, and leave a comment. Psychopathy is defined as a neuropsychiatric disorder marked by deficient emotional responses, lack of empathy, and poor behavioral controls, commonly resulting in persistent antisocial deviance and criminal behavior. Clinical observations have suggested 4 possible subtypes of psychopathy: narcissistic, borderline, sadistic, and antisocial. There are distinct differences between sociopaths and psychopaths. Socios tend to act more impulsively and erratically compared to psychos. They can struggle to maintain a job or family life, while psychos may be able to do both. Psychos generally struggle to form attachments, while socios may be able to form a bond with a like-minded individual. Psychopaths are able to disassociate from their actions and experience less guilt than sociopaths. Do the brains of psychopaths display a defect that is detectable by an MRI scan? Psychopathy is a term used in psychology to indicate individuals who display high levels of detachment or callousness, as well as impulsiveness or antisocial traits, such as destructive or aggressive behavior. Symptoms of psychopathy generally appear in early childhood and impact all areas of an individual's life, including relationships with family, friends, school, and work. It is estimated that 1.2% of the adult population has psychopathy, according to a 2021 study. Those with psychopathy tend to display antisocial behaviors, such as a lack of empathy and disregard for the well-being and emotions of others, which can negatively impact relationships, both personally and professionally, as they struggle to connect with and trust the world around them. Studies find that while psychopaths account for less than 1% of the general population, they are responsible for between 30% and 50% of all violent crimes. The most utilized method to assess traits of a psychopath in clinical or forensic work is the Hare Psychopathy Checklist Revised, developed by Canadian psychologist Dr. Robert Hare. The PCL-R was originally developed in the 1970s for use in psychology experiments, based partly on Hare's work with male offenders and forensic inmates in Vancouver, and partly on an influential clinical profile by American psychiatrist Hervey M. Cleckley, first published in 1941. The assessment includes 20 items on which individuals are rated on a scale of 0 to 2, based on how much their personality or behavior matches the item's description. This results in 2 primary scales, one to measure emotional detachment and one for antisocial behavior, which combined for a total score. The highest score an individual can get on the PCL-R is 40, and a score of at least 30 is needed for someone to be classified as a psychopath. Hare theorized that psychopaths cannot be rehabilitated and may even become worse with psychiatric treatment. Rasmus Rosenberg Larson, a lecturer in philosophy and forensic science at University of Toronto, Mississauga, challenges these theories. There was no evidence for the hard claim that a psychopath cannot be treated successfully. There was also no evidence that treating a so-called psychopath will result in faster recidivism or that they will be worse afterwards. In fact, there is a growing body of evidence to suggest that conventional treatment programs have positive impacts on psychopaths, he says. This is important because it informs how we prioritize treatment and rehabilitation efforts. The implications of these theories reach deep into the justice, forensic science, and mental health care fields, and can contribute to a lasting stigma for those who receive the diagnosis, Larson says, noting that a diagnosis of psychopathy can play a part in determining criminal sentencing, psychiatric treatment approaches, and even child custody arrangements. Chronic future risk is one thing that a psychopathy diagnosis communicates, but there is evidence that a person will score differently on the PCL-R depending on whether it is the prosecution or defense who hires the psychologist, he says. My analysis looks at whether it's reasonable to suggest that this could or should have an influence on those decisions. A study which took place in a medium security prison in Wisconsin was a unique collaborative between 3 laboratories. UW-Madison psychology professor Joseph Newman has had a long-term interest in studying and diagnosing those with psychopathy and has worked extensively in the Wisconsin correction system. The study compared the brains of 20 prisoners with a diagnosis of psychopathy with the brains of 20 other prisoners who committed similar crimes but were not diagnosed with psychopathy. This is the first study to show both structural and functional differences in the brains of people diagnosed with psychopathy, says Michael Koenigs, assistant professor of psychiatry in the University of Wisconsin School of Medicine and Public Health. Those 2 structures in the brain, which are believed to regulate emotion and social behavior, seem to not be communicating as they should. The study showed that psychopaths have reduced connections between the ventromedial prefrontal cortex, VMPFC, the part of the brain responsible for sentiments such as empathy and guilt, and the amygdala, which mediates fear and anxiety. Dr. Kent Keel of the University of New Mexico and the Mind Research Network has a mobile MRI scanner that he brought to the prison and used to scan the prisoners' brains. Koenigs and his graduate student, Julian Motzkin, led the analysis of the brain scans. The combination of structural and functional abnormalities provides compelling evidence that the dysfunction observed in this crucial social-emotional circuitry is a stable characteristic of our psychopathic offenders, Newman says. I am optimistic that our ongoing collaborative work will shed more light on the source of this dysfunction and strategies for treating the problem. There will be links to articles about the Hare Psychopathy test, Rasmus Larsson's dispute of the test's effectiveness, the psychopathy study in Wisconsin, and also an article from Psychology Today discussing the triune brain system and how some people who give in to base, primitive urges may be acting on impulses generated in the reptile brain, in the description below this video. The end? Stay tuned for more content from All Theory no conspiracy. Thank you for watching.